Good morning everyone. Today, I will be going over the nephrostomy tube dressing procedure as presented by Amanda Wiggins. We will discuss the steps needed for applying a new nephrostomy dressing, changing the bag, and flushing the nephrostomy. We will also cover the use of non-sterile and sterile gloves, Cavalon, M-Fix securement device, SorbView dressing, CHG prep, clave connector, 3-way stopcock, and TrueClose urinary leg bag. Let's get started. In order to dress a wound, you will need a pair of non-sterile gloves, a pair of sterile gloves, Cavalon, available as a spray or swab, an M-Fix securement device, SorbView dressing, CHG prep and a clave connector or 3-way stopcock. Perform hand hygiene, put on gloves, remove existing dressing, again do hand hygiene, wipe down work surface with disinfectant wipe, and place all necessary equipment and supplies on the table to begin nephrostomy tube dressing procedure after obtaining verbal consent. Ensure the patient is comfortable and has an understanding of the nephrostomy tube dressing procedure. Gather necessary items, wash hands and put on sterile gloves. Gently scrub the insertion site with chlorhexidine gluconate for 30 seconds, and allow to dry 3 to 5 minutes before applying a skin prep. Ask the patient which direction to attach the M-Fix securement device, and cover with a SorbView. In this fifth slide of the presentation, I will go through the steps of the nephrostomy tube dressing procedure. The M-Fix securement device must be carefully mounted around the catheter, making sure that the foam block with the V-notch inside is as close as possible to the catheter. With your finger on top of the slit, gently remove the right hand liner and attach the left side of the device to the skin. Ensure the device is securely attached before removing the top liner. Place the catheter on the foam block and secure it with the Velcro lead, making sure that the cover fits tightly around the catheter to protect the puncture site. To inspect the puncture site, simply reopen the Velcro late.
Mount the M-Fix device carefully around the catheter. Be sure that the foam block with the V-notch in it gets as close to the catheter as possible. Place your finger on top of the slit while removing the right hand liner. Remove the left hand liner and attach the left side of the device carefully to the skin. Check that the device sticks to the skin. Remove the top liner and place the catheter on the foam block. Place the Velcro lid over the catheter. Make sure that the lid fits tightly around the catheter to protect the puncture site. For inspection of the puncture site, just reopen the Velcro lid.
To change the bag of a nephrostomy tube, first clamp the nephrostomy tubing or kink it, then remove the old bag. Scrub the hub of the nephrostomy pigtail with alcohol or a CHG pad for 15 seconds. Optionally, if a stopcock is needed, add a 3-way stopcock or clave connector to the tube. Attach a TrueClose urinary leg bag, and twist the blue cap urine drain closed. Unclamp the tubing and ensure that the drainage bag is closed. Finally, secure the TrueClose bag either to the leg or at the waist. To flush the nephrostomy tube correctly for slide number 7, first turn the stopcock so that the flow is directed towards the kidney, ensuring that the off arrow is facing the bag. Then, flush with 3 to 5 cc of normal saline as specified by the MD order. Finally, turn the stopcock so that the fluid can flow back into the bag. A handout at the end of the presentation provides more detail. Thank you for your attention and I hope this was helpful.